Hello everyone, welcome to Dentistry. Today we are back with human physiology where we are continuing our unit nerve muscle physiology, and our topic for today is neuromuscular junction or NMJ. Please mark this topic as one of the most important topic you can have as long note in your profs. So let's begin. Okay, before starting, let me remind you, you can ask your doubts or can comment anything in your comment box and we will surely provide you the PPT of this slide. So let's begin. First, what is NMJ? NMJ stands for neuromuscular junction. It is the junction between the motor nerve and skeletal muscle fibers. NMJ is the synaptic connection between the terminal end of a motor neuron or the nerve and a muscle. It is the site for transmission of action potential from nerve to muscles. First, let us know the structure of NMJ. At the terminal nerve ending, there are many mitochondria and synaptic vessels, which contain acetylcholine responsible for the transmission of impulse. Okay, let me show you the picture. So this is the basic structure of neuron, or I would say the NMJ. Next, we have the membrane of nerve ending called the presynaptic membrane, the postsynaptic membrane, and in between we have the synaptic space, or that is known as synaptic cleft. Acetylcholine receptors are found on postsynaptic membrane. NMJ is specialized for transmission of impulse from nerve to skeletal muscles, which is called the neuromuscular transmission. As the name suggests, neuromuscular transmission means from nerve to the muscle fibers. Hope it's clear for you guys. Next, we come to the sequence of events occurring at NMJ. The nerve impulses reaches from presynaptic membrane and open the calcium channels. Then what happens? The calcium channels influx causes the movement of the vesicles towards the presynaptic membrane. Then the fusion of vesicles occur with presynaptic membrane, causing the release of acetylcholine into the synaptic cleft. From the presynaptic membrane, let me show you the picture. From the presynaptic membrane, it moved to the synaptic cleft by a process of exocytosis. Next, the acetylcholine after its release diffuses to the postsynaptic membrane, that is the motor end plate. From presynaptic, it will move to the postsynaptic membrane. Next, the acetylcholine attaches to the nicotinic acetylcholine receptors on the motor end plate, that is the postsynaptic end, and open the sodium channels. Firstly, what happens? The nerve impulses coming from the nerve reaches the presynaptic membrane and opens the calcium channels. This much is clear. Next, this opening of calcium channel causes the influx of calcium ions, leading this acetylcholine to move towards the presynaptic membrane, which diffuses through the presynaptic membrane, crossing the synaptic cleft, move to postsynaptic membrane, that is known as the motor end plate. यहाँ तक clear होगा hopefully. Next, what it comes, when the acetylcholine reaches to the nicotinic acetylcholine receptors. Where are these nicotinic acetylcholine receptors present? They are present on the postsynaptic membrane. So when these acetylcholine receptors attach to those nicotinic acetylcholine receptors, they open the sodium channels. This causes the influx of sodium channels, causing the depolarization of the postsynaptic membrane and generation of local action potential called end plate potential. Please mark this word, end plate potential. Sometimes it can be asked what is end plate potential. यहाँ तक सबको क्लियर है? सबसे पहले जब नर्व इम्पल्स रीच करता है प्रीसेप्टिक मेम्ब्रेन को, दे ओपन द कैल्शियम चैनल्स. कैल्शियम चैनल ओपन होगा तो क्या होगा? जायज़ सी बात है, देयर विल बी इन्फ्लक्स ऑफ कैल्शियम आयंस which will lead to the movement of acetylcholine towards the presynaptic membrane. This acetylcholine will cross the synaptic cleft through diffusion and will move to postsynaptic membrane. जैसे acetylcholine will attach to the receptors, it will cause the opening of sodium channels. और जब sodium channels open हो जाएंगे, it will lead to the influx of sodium ions and causing the depolarization of the postsynaptic membrane. This is known as end plate potential. Now, When this end plate potential reaches a threshold of 30 to 40 millivolt, it depolarizes the muscles and results in the generation of action potential. यहाँ मैंने स्टेप्स दे रखे हैं स्लाइड्स में, आप लोग रीड कीजिएगा, आपको समझ में आ जाएगा. This 30 to 40 millivolt, then it is known as the generation of action potential. This propagated muscle action potential, which can travel in both the directions along the muscle or along the muscle membrane. Yes. Hope so the sequence of events is clear. Make this diagram positively in a proper manner and include it in your answer. Next we come to the clinical importance of NMJ. Blocking of neuromuscular junction produces muscle relaxation. When muscle relaxes, what happens? It facilitates in surgical operations by providing open fields. Surgery में help करता है. It reduces the movement during electroconvulsive treatment of psychotic patients. Psychotic patient के treatment में help करता है. Causing blockage of neuromuscular junction can be achieved in two ways. They are by inhibiting the synthesis and release of acetylcholine from presynaptic membrane, or number 2, by the drugs which antagonize the action of acetylcholine on the postsynaptic membrane, that is the motor end plate. So neuromuscular junction को block कैसे कर सकते हैं? ये दो मेथड है ब्लॉक करने को. Okay, there are some additional informations like the drugs that block the NMJ are, firstly it is D-tubocuranin and secondly it is सक्सामेथोनियम. पूछा नहीं जाता है, जस्ट फॉर योर नॉलेज. ये दो ड्रग से भी हम एनएमजे ब्लॉक कर सकते हैं. नेक्स्ट वी हैव द अप्लाइड फीचर, जस्ट लाइक वी डू इन एचए. अप्लाइड फीचर ऑफ एनएमजे दैट इंक्लूड myasthenia gravis. What is myasthenia gravis? It is a rare autoimmune disorder caused by the antibodies formed against nicotinic acetylcholine receptors. Okay, so where were these nicotinic acetylcholine receptors? They were present on the postsynaptic membrane. I have already explained this in the sequence, right? Next, the end plate potentials are mostly too weak to produce the action potential. Basically, myasthenia gravis क्या होता है? Weakening of your skeletal muscles. The most commonly affected muscles are, see, they are the extraocular muscles, facial muscles, swallowing and mastication muscles. This can even cause the death of patient due to the paralysis of respiratory muscles. यहाँ muscles hide हो गया है, but you can understand it causes the paralysis of the respiratory muscles. So main symptoms of myasthenia gravis includes change in voice, facial paralysis, fatigueness, weakness of eye muscles, breathing difficulty, difficulty in chewing and swallowing, difficulty in climbing stairs. Obviously, if you have breathing difficulty, then you will face the difficulty while climbing stairs. And lastly, difficulty in talking, as well as drooping position of your head. So these are some symptoms of myasthenia gravis, which is one of the most important question along with NMJ. अगर लॉन्ग नोट में आया तो you will include myasthenia gravis in your answer as well. Else myasthenia gravis में अलग से short note भी पूछा जा सकता है. So NMJ guys, this is enough for today. In NMJ we have the long note as I mentioned earlier. Keep learning, keep supporting our channel. Thank you so much.